Susan, thank you so much for being here. Before we get started, just tell us a little bit about yourself.
I've been at Vive for like 5 years. I'm the admissions director there. I enjoy what I do because I get to help families and kids find the care that they need. Is that what you meant? Like
Yeah.
when you said, tell me about yourself? Okay.
That's perfect.
I like
Um,
puppies.
I love it. Puppies, long walks.
Right.
Um, well, let's just start going into questions and these were questions that a lot of parents are you've probably experienced already. You've heard, just so that they can watch this and be guided on their decision making, help them pull the trigger or not.
Sure.
So let's just describe what Vive is. What makes it different than other treatment centers?
Yeah, that's a great question. So, Vive is different because we have multiple levels of care, individualized care. We can individualize care for the child's needs and meet them where they're at because we do take kids that are struggling with a variety of different reasons. We have amazing providers and clinicians and staff that are all there to support the child and the family during their time at Vive. I feel like Vive is special in that we meet the kids where they're at. We have qualified, compassionate, gifted people involved in their care so that we get the very best outcomes for those kids.
That's awesome. I think that we have a misconception on, like mental hospitals and things
Sure.
like that, right? Hollywood has really painted a picture in all
Mm-hmm.
of our brains. What do you think are some misconceptions, or maybe explain like what's the feeling inside Vive? Like what can they expect to see and feel, and what's the general vibe?
Yeah, so for the kids while they're there, I've seen that level of uncertainty when they first get there until they realize that it is an extremely safe place, both like emotionally, where they can do the work that they need, focus on themselves. It doesn't feel institutional at all. It's warm, it's comfortable, everything from good food to comfortable beds to qualified staff that do this all day, every day. So while every child is struggling with something a little bit differently, you also do see common themes involved in that. So um, our team is extremely well equipped to deal with the challenges that these kids are having and meet them there.
That's awesome. I love the idea of meeting the kids where they're at.
Yeah.
I think that's fantastic. So who is eligible for admission here?
So really, we don't have that many rule outs. We're a generalist program, so we're taking kids for a variety of reasons and mental health crises. So kids that are struggling with severe depression, self-harm, suicide ideation, mental health struggles associated with trauma, everything from psychosis, hallucinations, really the whole gamut of different mental health struggles that we're seeing right now in adolescents are basically, if they are a risk to themselves or even others sometimes in the home, they are appropriate for Vive. We can help them.
That's awesome. If someone has questions, like maybe questioning, like, is it too early to send my kid there? You know what I mean? That type of thing. Is there somewhere that they can call, what I mean, to have those questions answered, to fill up, to be able to articulate their specific needs?
Yes, definitely. So we do have a 24-hour, 7-day-a-week phone number that they can call that's staffed all the time because we do take kids on an emergent basis, so kids that are actively in crisis. So we can answer parents' questions regarding the level of care, appropriateness, and even alternate options if it's not a good fit for Vive for whatever reason. So
That's awesome. How quickly can my child be admitted in a crisis?
We are set to take kids very, very quickly. So we can do an admit just as quickly as parents or referral sources or whomever can work with us. We're set up to do it remotely, so everything is online. We're going to talk to you, get some basic information about what's been going on for the last 3 or so days if it's a crisis emergency situation, and get your child over to Vive as quickly as possible, get them safe, and get them started getting better.
What insurance plans does Vive accept?
We accept all major insurance plans and regional plans as well. We have kids that admit to us from across the country. So if you have insurance, we are most likely working with them.
Cool. What's the cost if insurance doesn't cover it?
That is a great question. Rarely is there a situation where insurance doesn't cover. But we do have self-pay rates that we can make available to somebody if that is the case.
I heard you guys do a strip search. Is that true?
No, not in the way that that's worded. We do a skin assessment when a child first comes in. It's done respectfully and compassionately. I've been there for those, and I've asked kids, was that as bad as you thought it was going to be? And they're like, no. So we have nursing. Our nursing team is in there for that.
So explain to me what a skin assessment entails.
Sure. So the client goes back behind a curtain, so they're not completely exposed at any one time. They remove their clothing. They're given a hospital gown to put on, and then they show each part of their skin to the nurse. There are 2 people in the room during that time. The nurse is doing the actual assessing and of the skin and the body, and then the other person is in the room. And they're just exposing like their leg at one time, their other leg, and they're just looking for any self-harm marks, scars, tattoos, just documenting what's going on. They are also looking for possible contraband. So if a child is, for example, struggling with self-harm and they have brought something or have something on them at that time, we are able to find that and retrieve it so that we can keep them safe and they're no longer able to do that. So
No, that's awesome. And it makes sense. It just seems like it's pretty standard protocol.
it is standard protocol, and it really is done in a way that respects the child and that they're comfortable with it.
That's awesome. This is about bad reviews.
Okay.
Right? So the question is, I saw bad reviews online.
I could speak to that.
Okay.
Sometimes there are unrealistic expectations regarding the, fixing somebody's child. Sometimes mental health concerns and issues are complicated and they're ongoing for some time. Overall, though, I think with the level of care that we offer and the complexity of the kids that we serve, sometimes we have exceptional outcomes and many positive, much more positive reviews than we do negative ones.
We've kind of talked about it a little bit, but how do I know if Vive is the right level of care for my child?
Yeah, so basically there's a couple of different ways to know if inpatient is right for your child right now. I mean, if they are a risk to themselves, if they aren't able to do the things that you would expect a teenager at that stage in their life to do. So, for example, going to school, coming out of their room and socializing with their family, being resilient to, certain things that's expected in a child's life at that stage. If those things throw them off to the point where it sets them back from participating or finding joy in their life as they should for where they are, then I would definitely say that it's possible inpatient is appropriate for them. You combine that with the fact that sometimes it's necessary to get therapy on board or any possible medical interventions on board quickly and efficiently, and an inpatient stay allows for that, as compared to going to a medical provider, say a psychiatrist or whoever. First you have wait times, and then you're going to most likely be given something, and then it's going to be reviewed for efficacy, and then you're going to go back again. Whereas an inpatient stay with Vive allows for that kind of deep dive into clinical and medical, all under, one roof, all at the same time, rapidly, professionally. And it's a huge kickstart for a child that's really struggling. So,
What happens if my child refuses to get out of the car upon arrival?
sure. There's a lot of anxiety associated around something new, and they're probably already struggling because that's why they're admitting with us. So, we have had that happen in the past, and our team is, prepared to deal with that. We do like to make that process as quick as possible so that anxiety doesn't, keep driving it up. So we do like to advise families to, be prepared as possible, say your goodbyes and everything. And then we can take the child back and have the family go on and go ahead and leave and start doing the work that they need to do, and then communicate with them shortly after the child is admitted and done intake and realized that they're safe and has been able to, decompress and stabilize.
I love that. But do you guys offer any other financial payment plans or anything like that?
We do. We have financial assistance for those that qualify. We have payment plans that we have flexibility in. One of the really great parts about that aspect of a stay at Vive is that our billing team is on site. They know these kids, they know the families, they know why they're at Vive, and they're going to work extremely hard and fight for the coverage and the care that child needs, because they are local. They're right there under the same building. We want the very best outcomes for that child across the board, including financially. We don't want that to be a barrier for kids getting the care that they need. So they're going to work with them to the full extent that they're able to.
What personal items can my child bring?
Yes, so we do provide a packing list. They don't need a whole lot. We like to keep things really simple. They're there to work on, whatever struggle that they're having. So we provide like the bedding, we provide their hygiene. So they really only need several pair of clothing. We're able to turn that around, wash them, clean them and everything, get them back to them pretty regularly so they don't have to come with a bunch of stuff. We provide like their art supplies, their journal, all those type of things. They are able to bring a couple of like religious material or uplifting books. We have universal precautions in place because there's kids that are struggling there for different reasons. So even if one child isn't struggling with suicide ideation, another child may be. So, things, clothing with strings aren't allowed regardless. So slides are great. Bottoms that don't have drawstrings, or we can cut them out. But yeah, we have a complete packing list that we include with the admission documents.
That's great. Are legal guardianship or custody issues a barrier to admission?
No, not at all. So the legal guardian or parents are able to admit their child. Because we do take kids on an emergent basis, there's basically that aspect, the same as if the child were, to be in some kind of accident and break their arm, regardless of who has custody at the moment. If that child needs emergency medical care, they're going to get it. And then the rest can kind of be sorted out in the coming days. It's great if all parties are involved, and we definitely want them to be. But as far as for that like emergent admit portion, whoever has custody or is the guardian, they are able to admit them.
Awesome. What happens if my child wants to leave?
So it's I mean, sometimes kids, as they're doing their work, or they may get homesick, or they may have some challenges in front of them doing maybe their therapeutic work, and want to get back home. We work them through that. We have amazing therapists that can work them and remind them about what their goals are, what they're trying to achieve before they get back home. We are a secured facility, so a child is not able to leave on their own without discharging to their family or guardian. All of our kids need to discharge to some kind of continuing care, so that's going to be in place as well when they discharge.
You kind of already mentioned this a little bit, but do you accept youth from hospitals or EDs?
We do. We're actually, again, set up to take a child that's in crisis really, really quickly. So it's not uncommon for them to come through the emergency department or the hospital. So yes, we do.
What screenings are done pre-admission?
So we're basically quickly gathering some information about what's been going on with the child in the last little bit. If they've attempted to overdose, say for example, having what they overdosed on is extremely helpful. So we're just quickly almost triaging the situation. It's helpful for insurance coverage, and also so that our medical providers and our clinical team have that information so they can really jumpstart with the care. So we're basically just finding out what's been going on. Has the child been, if they're depressed, are they currently cutting? When was their recent possible attempt, if that is the case, to end their life? What are some other examples of the types of things that we're asking? Any current medications that they may be taking, but a lot of that can also come the next day if we need to really move quickly and get the child in. So the more information that we have on the front end, the better, just because it gives our kickstarts our treatment team in their process. It helps our billing team get better outcomes on the front end, but we are set up to do emergency admits, so we can run with minimal information as well. We just want the child to be able to admit quickly and get safe and get started on treatment.
Do you hold beds?
We don't hold beds. It's usually not really necessary because of our length of stay. Our census is pretty fluid. We usually have children discharging around the same time that we have kids admitting. So there is often a bed available.
What are your exclusionary criteria?
Exclusionary criteria would be disordered eating would need to be, or an eating disorder would need to be secondary to like say depression or suicide ideation. If a child is extremely aggressive just for the sake of being aggressive, that's been their go-to inside the home, outside the home, in school, that may be a rule out. That said, we look at that on a case-by-case basis. So that's another really great thing about our admission process, is we're not looking at some black and white checklist. We understand that adolescent mental health has been changing over the last several years. It presents differently. So we're looking for context regarding certain behaviors that some other people might consider a rule out. But yeah, if aggression is just their go-to, or if they are predatory in nature, sexually acting out, those would be rule outs.
Cool. What is your medical clearance requirement?
So if they have attempted to overdose on certain medications, then may need a prior hospitalization stay, that would just kind of be reviewed in that initial call, because we do have medical providers on site every single day, and they do have protocols that they can put into place with certain medications or substance use. So it doesn't always mean they have to wait to admit, if that makes sense.
Yeah, absolutely. Susan, thank you so much for coming and being part of the show today. Is there anywhere, or where should people go if they want to find more information?
So they can go to our website at vivetreatment.com. That there's links to our admission process and our admissions team there, and our number and then our admissions team, like I said, is available 24/7, and they're happy to answer any questions or speak to any concerns or appropriateness at any time.